afternoon, everyone. I'm Dr. Akhila Ayyagari, consultant fertility specialist, Sudha Hospital, Banjara Hills, Hyderabad. So today we are going to talk about what is IVF, what is the procedure. Coming to the definition, IVF would mean in vitro fertilization, which basically means taking the eggs out from a woman's body, mixing it with the husband's sperm, making embryos, and then these embryos are further inserted into the woman's uterus. This is IVF. Now, let's quickly understand when do we actually go ahead for IVF. So it can be male factors, it can be female factors. Like I say in all my videos, infertility is not a woman's problem, it's a couple's problem. So in males, if there is no sperm at all, which is azoospermia, or if the counts are very low, motility is very poor, these are some of the conditions where genetic causes and ejaculatory problems, retrograde ejaculation, these are some of the conditions where we opt for IVF. Coming to the female causes like blocked fallopian tubes, endometriosis of grade 3 or grade 4, poor ovarian reserve, that is low AMH or poor quality of the eggs, and genetic causes again in the females, uh, previous IUI failures or unruptured follicles. These are some of the conditions where we opt for IVF treatment. Now, what essentially happens in an IVF treatment is a woman comes in on the first or the second day of her cycle, and we typically perform a pelvic examination, and we do a pelvic scan. And thereafter, we start her on gonadotropin injections. Daily, the injections are given at about the same time, and for a period of 10 to 12 days. Most women respond in these 10 or 12 days. The response is noted through an ultrasound, a scan. Every alternate day, we do a scan to check how the follicles are growing. About more than 14 we usually consider it as a growing egg, and about 18 we consider it as probably a mature egg. And once three or more follicles are more than 18 we plan for a retrieval of these eggs. That is, we plan for removal of these eggs from the body, taking them out. We give a trigger injection for the maturation of these eggs. And the retrieval process is also a very simple process. It takes about maybe 10 to 15 minutes. It's done under anesthesia, that is IV sedation, for about 10-15 minutes, and through the ultrasound machine, transvaginal ultrasound probe, we send in a needle, and these eggs are sucked out, aspirated out through a suction machine. Once the eggs are collected, they're looked at under the microscope, and the mature eggs, that is M2, oocytes, are taken, mixed it with they're then therefore mixed with the husband's sperm, and embryos are formed. We wait for 5 days after the egg and the sperm are mixed. That is, that day is counted as 0, 1, 2, 3, 4, 5. On the 5th day is when we expect a blastocyst formation. We normally go ahead for day 5 transfers, which are better off. And these embryos are typically transferred in the next cycle. If they're transferred in the same cycle as the egg retrieval cycle, it's called as a fresh transfer. Normally, we prefer to go for a frozen transfer, which is then done in the next cycle. That is, the next cycle, the woman comes in again on the day of the period, the first or the second day, and the transfer is planned after about 10 or 12 days after the menses begins, about maybe day 14 or day 15, depending on which protocol we're using to plan for the embryo transfer. So it takes about, when you consider the timelines, about 2 months is what it takes if we're just planning for the egg retrieval and the transfer process. And in between, sometimes we may have to look at the inside of the uterus, how the endometrium is, which is a laparoscopy. If needed, which is a hysteroscopy, sorry, the inside of the uterus. If needed, laparoscopy to see how the exterior of the uterus is, how the tubes are. If this is also planned, it may take another extra 1 month. This is typically IVF, the procedure. And coming to the costs, what we normally know is the cost of the injections that take place, the cost of the medicines involved, and these are the costs that are quite evident. And what is apart from this is the lab, the maintenance of the lab, and the equipment that we use in the lab. So, high-end equipment, once a lab is equipped with, it obviously adds on to the costs because costlier equipment gives better results, and the skill of the doctor, the skill of the embryologist, well trained doctors and embryologists as a teamwork obviously will give a better result. And these are the two things that probably add on to the cost when you look at it uh, as such. What we normally see is only the medicines, and the rest of it is because of the lab, because of the trained personnel that you have. And this is what is IVF. The success of IVF typically is around 40 to 50% for a single or a double embryo transfer. This is about IVF. Thank you very much. So I have a few questions. Do IVF always result in twins? Is there any chance to give birth? So I was just telling you the success rates as 40 to 50% depending on a single or a double embryo transfer. If you're looking at a single embryo transfer, the success is about 40%, 40 to 45. If you're doing a double embryo transfer, it's about 45 to 50%. And with a risk of twin pregnancy of about 20 to 25%. So not all patients with a double embryo transfer land up with twins. It's only about 20 to 25%. So in simple terms, if 10 patients are subjected to an embryo transfer, maybe 5 or 6 out of them will be positive, of which maybe 1 or 2 at the most may have twins. Next question, do IVF impact normal life? No, the injections are given only for about 10 to 12 days. So it doesn't impact normal life, but it is a little tedious, which means you have to come to the center every day, take injections at about the same time. So that's what makes it maybe a little difficult, but otherwise it doesn't really have any health impact or future complications as such. Will it pain during the treatment? None of the procedures are painful. They're all embryo transfer is not even done under anesthesia. It's only the oocyte retrieval process, that is the pickup, which is done under anesthesia. And it's only for about 10 or 15 minutes, and you were sent back on the same day. No IVF procedure as such warrants an admission. They're all daycare procedures. Nothing is really painful. It is just that it's a little tedious. It takes about 2 to 3 months, and the days you're having injections, you have to time the injections at the same time. That's what it is. Does IVF involve surgical procedures? Yes, one surgical procedure, that is the oocyte retrieval. If hysteroscopy or laparoscopy is needed, then we do that as well. Otherwise, it's only the oocyte retrieval, which is a surgical process done under anesthesia. Embryo transfer is another procedure that we do, and that does not require any anesthesia. It is just like any other IUI that we may do. That is just a scan under the ultrasound guidance. We put in a catheter and place the embryo in the uterus. After menopause, is that possible and effective? Yes, definitely. We sometimes have women with premature menopause. It depends upon how many eggs we can see, what are the hormone levels. Based on that, IVF is possible. Thank you so much.